Hi everyone, I'm just here to give you my 1 year finding out about my tongue cancer update. Just to let you know what I had. I don't know, tongue cancer. They cut it out. They cut my neck hair to the back, and they removed the lymph nodes. They tested them. One of them, they saw metastasis, so they went ahead and removed the other ones, the next level. I think the cuts here. Um, and they also opened this again and removed the bottom ones there. So basically, this was the first surgery, my tongue and here, and the second one was here again and down here. Then after that, about a month later, I had the chemotherapy start with cisplatin, and then 35 sessions Monday through Friday of the radiation, which they got me basically in this area. I didn't lose my hair from the chemotherapy because after the first one, after the first cisplatin, or after the second one, sorry, I got a little bit sick. I think it was just too much medicine in my body, so they went ahead and gave me like an antibody for the third chemotherapy. So I didn't lose my hair or anything. The chemotherapy wasn't a big deal. It was the radiation that actually I lost my hair kind of on the back here, and it's growing back now a year later. It's maybe 2 inches long. So just down here, this whole bottom section slowly fell out. As you can maybe hear, I can't say my S's very well. It kind of sounds like an SH. And I have dry mouth, so I carry water with me everywhere. And also, let's see, I can't taste food as much. It's coming back slowly, but it's definitely not 100%. And I don't think it will come back 100%, but who knows? It's only a year out. Water tastes a little bit strange to me now. I can't really have a lot of vinegar, acidic food. I think I have Frey's syndrome now, where because I lost some of the salivary glands. The radiation pretty much kills about 40%. So now, since I don't really salivate that much, I think the nerves that were killed end up growing into like your skin on the surface of your face. So if I have something that's acidic or salty or spicy, which I can't have too much spicy stuff like I used to because it's just too much pain. But I'll start to sweat here and above my brow like ketchup. Yeah, it's really painful. Anyway, let's see what else. Other ways it affected my life. The speech thing, I'm more conscious about my speech. Some people say they don't notice it, but I notice every time I say an S word. Sometimes my voice changes. I think my voice is a little bit deeper now. And sometimes even in the afternoon it sounds like I have morning voice. What else? I don't know. Here in my neck, since I cut here, and the radiation, this muscle here is, as you can see, it's kind of sticking out, is really tight, and so I can lean my head about this far, but on the other side I can go a lot further. I can't really turn my head a lot before I feel it start to pull, but it doesn't really hurt that much. Yeah, and then just the tongue, the volume is less over here. And then the radiation also messes up your gums. So my teeth, like the root of my teeth on both the top and the bottom, are painful. Like if I drink something that's not warm, a little bit warm, I can feel the pain in my gums or down on my teeth. Like on the bottom there, it's a little bit more exposed, and then you have all kinds of fun enamel problems and things like that because you don't have the healthy bacteria in your mouth. So you have to keep brushing and flossing and doing all that stuff. The oral care increases. Next thing, I'm basically trying to prevent the cancer from coming back. So my favorite thing to do is physical activity. I've been on my bike a lot, but also I'm watching everything that goes in my mouth. I found this book is really helpful. This is the Gerson Therapy. It's a natural way to cure cancer, but I'm kind of using it as a prevent the cancer from recurring. So I'm using the coffee enemas and the carrot apple juices every day. It makes me feel pretty healthy. I'm also in a place where I have access to Iscador. It's also called Iscador. It's also called mistletoe therapy. It's basically it's made by the company Valeda, or it looks like Weleda, but it's German. These are the little vacuoles, and I open them up and inject them into my body Monday through Friday, 3 times a week. And that's supposed to prevent the cancer from coming back, as well as the other part of the treatment is every 2 weeks I take a high dose of vitamin D, because even though I'm in the sunshine all the time when I ride my bike and everything, it's still not enough, I guess, because the UV or everything in the atmosphere is preventing us from really getting that vitamin. So I take it. So I take a supplement, and then I've just tried to eliminate, like, on a bike all the time. I think I was drinking a lot from plastic bottles, and we know the plastic isn't good, so I have since switched over. I dropped the money and paid for the clean canteen. Stainless steel bottle. It comes with a cap, or you can get one without this piece. It just screws on, and that fits into my water bottle holder. So stainless steel, the way to go. With everything. Pots and pans, get rid of aluminum. Aluminum is also in your deodorant, so they have these little, it's like a crystal stick. You just put water on it, and this is my deodorant. I've gone to organic hair products and cleaners. I think this can be at Walmart, organics. It's just like a gel, but I have the shampoo as well. Also, this product is the most amazing thing, especially when you're in the hospital and you don't get to shower every day. It is the Dr. Bronner's Magic Soap. It is awesome. This is what I use to wash my hands now, wash my face. Since I have the cancer up here, I'm trying to get rid of all the paraffins and all the chemicals and things that I put on my head, on my face, and I mean, I don't even like to use lotion anymore because all that stuff is going into your skin. So I advise the peppermint. It smells good. What else? Probably that's mostly it. I'm just trying to wrap my head around all this. It's coming up on a year, and I have a PET CT scan in a few weeks. I was actually going to wait for my 1-year anniversary on Halloween to make this video, but I couldn't wait any longer. I really wanted to communicate this with the community out there who are young. I'm only 31 now. I was diagnosed when I was 30, and it was only a month later that I went ahead and had the surgery. So the key thing is, when you see something funny on your tongue, it hurts just like a typical ulcer. After 2 weeks, you need to go get it checked out, and a lot of dentists don't even know. They won't know what it is. They'll just say it's a sore. They'll give you a cream. Have them do the biopsy if it's been more than 2 weeks, because a lot of times they'll find that it's cancerous if it's starting to grow. I mean, mine was about like this on the base of my tongue, about 1.5 centimeters long by about 1 centimeter high, and I'm not sure how deep it went in, but they think that didn't really spread just to the one lymph node. But when they find it in one, they take all of them out because they want to be safe. And then they just gave me all the highest level, I guess, of radiation that would kill anything else that was possibly in there. But now I'm trying to, use some of these alternative methods and prevent it from recurring. Yeah, I think that's all I have for now. If you have any questions, feel free to post them. I'll probably put some links where you can find some of the products if you're not sure. Most of these products almost all of them you can get in the United States. Some of them I had my family send. I'm out of the country now, so I had them send them to me. I will say one thing. During the radiation, I had a lot of pain. I had mucosis, and my mouth was completely dry, and I couldn't even drink water. I had to get a feeding tube. My mouth had cuts and sores, everything, all over. I did use a product called Juven. It's Juven. You can go to juven.com. It's supposed to help your skin heal quicker, especially if you have scars and things like that. Some people don't even notice my scar because it's kind of in the fold of the neck, but I think it also helps with the tongue. So I feel like that was a really good product that I used during the chemo, the radiation, all of that. So the sooner you can get that, the better, and do it for as long as you can afford it, because it's not cheap, but I think it's really worth it. Juven, it's just get the non-flavored powder, mix it in with your drink, and 2 times a day, and I think it really helped my tongue to heal. And then the morphine, like I said, the morphine didn't help while I was in the hospital, so yeah, I was looking for some medical marijuana here where I'm at, but I couldn't really get it because I'm in a different country. But I don't know. I was at the point where I was considering doing that because I was in so much pain. But yeah, I guess that's all I have for now. If you have any questions, feel free to ask me. And yeah, all I can say is good luck and say your prayers, because it's a tough process, but you can get through it. Here I am a year later, and yeah, still eating, still alive, still going. We'll see how the scan goes in a week or two. But good luck, stay strong, and maybe I'll do a 2-year update. We'll see. All right, see ya.